We are essentially a referral-based service, and although patients can refer themselves if they want, we do expect them to have a dentist to look after their general health. We looked up a few months ago at how many different dentists refer to us at the moment, and we found that there was over 200. Some are referring more sort of adult patients for private treatment, and some more purely NHS. And obviously there's a mix as well. If somebody hasn't got a dentist when they come to see us as a private patient, then it's an opportunity for us to link them up with some of these people, and so that's generally what we do. The index of orthodontic treatment need is what we use to define whether somebody would qualify for NHS treatment or not. Gaps are something which don't really score very highly, but are one of the more emotive things that patients will come and see us about. So if somebody comes to see us with a gap and they don't qualify for NHS treatment, then private orthodontics can solve that very straightforwardly. For me, if we scan, and we've done this, we've scanned people's teeth, and then we can show them that scan, and then we can move the teeth around for them in the way that they would want that, and then they can view what their teeth look like. There's all sorts of ways that we can use digital technology to help both the dentist but also help the patient's journey as well. I think that communication with the dentist can really help give value to what we're doing as a team for the patient, if there's a combination of restorative work, surgical work, and or restorative work going on at the same time. We can just send them images via email if they want. We can potentially send them the STL file. So I left school at 16 and I became a dental technician. During that time, I feel lucky really that I was working with Professor Foster. I was always amazed by him coming into the laboratory and talking to me about my work, and also he would ask me to go out and see patients with him. So that gave me a reasonable appreciation of kind of what goes on in general dentistry. And then I did my second part fellowship and applied to do orthodontics. It just never left me really from my days with Prof Foster. So I applied to do orthodontics. And I got my place at Guy's and spent 3 years there. Again, they had quite good links with other departments, so I learnt quite a bit about how orthodontics links in with other specialties such as surgery, restorative. I did work as an associate for about 3 years, and then set up this practice, and a patient came to see me who was asking me about lingual orthodontics, and I hadn't realised what that journey would take me on. About a year later, there was a gentleman from France giving a talk on lingual orthodontics, and he just suggested that if anybody was interested, that he was thinking of setting up something called the British Lingual Orthodontic Society. That started the sort of process then of learning a lot more about lingual, so I started going to conferences around the world, and during that time I got to know, I suppose, the great and good of lingual orthodontics around the world, and I went from being the sort of website person to the chairman of it. I kind of came off that role, and then decided that I wanted to sort of spend a bit more time within the practice again. So that's what I've been doing for the last few years, but over this past year there's been quite a lot of new technology coming into being, and so we've been bringing the appropriate technology into the practice and developing that.